I'm Lyn Sykes and I live here in Dubbo, and today I've been asked to talk to you about communication. I guess the reason I've been asked to do that is that I have a background originally in nursing and then in counselling, and in recent years in facilitating family business meetings. Particularly, I've been asked to talk to you about communication in the palliative care setting. So there's no doubt at all that those working in this area are wanting to be helpful. Like most people who work in helping professions, your aim is to make it easier for the people that you're working with. Unfortunately, communication has the potential to do that. It also has the potential to make it even more difficult. So before we get into the detail of communication, there are some overriding principles, I guess, that I just wanted to slip through. There are about 5 or 6 of those. The first of which is, if you want to be helpful to people, it really is helpful to understand, first of all, what are their needs and their concerns. It's the fundamental principle of basically working with people in a helpful way. My belief, however, is that it's not only important to understand the client or the patient's needs and concerns, it's important to have a clear understanding of your own, so that when you're working, particularly with families in the palliative care setting, you're very clear about your boundaries, and that helps you be clear about theirs. So the first is being clear about their needs and concerns. The second principle that I think is crucial to working effectively with people in any setting, but particularly in the palliative care setting, is to have an understanding of yourself, to have an understanding of your own vulnerabilities, to have some good insight into your own strengths and your own weaknesses. So that's the second principle. The third is to try and have at least a basic understanding of family dynamics. When a family finds themselves in any stressful situation, and certainly I found this when I was facilitating family business meetings, they come to you, or they come to the palliative care setting with their family dynamics already really well established. So it's not a good time to try and change the way families function. Particularly depending on their age, the older they are, the family, the more entrenched their family dynamics will be. So if you want to be effective in working within their dynamics, it's good to be able to have a reasonable understanding of them. It's not a great time to be making judgments of families, or to be trying to pressure them to do things that are not normal within their own family dynamics. So that's the third principle. Before I move on to the fourth, when we're talking about family dynamics, it's also good to have, like everything else, a good understanding of your own family dynamics. What are the things that, the beliefs, the values, the dynamics in the family that initially that I grew up in and that I'm now in? What are those things that might potentially, without me realising it, come to influence the families I'm working with? Again, it backs up the issue about boundaries. It's really important for anyone working with people in vulnerable situations that my stuff remains my stuff and I'm available to them for their stuff. So that's the third basic principle. The fourth is about not being judgmental. When we see families or communication that is different to what we think and we know or that we're familiar with, it's very easy to slip into a critical and judgmental role, and that will definitely affect the way that you communicate with a family. So if you're looking to build trust and a good communication with people, it's crucial that you make no judgments. And so many of the judgments that we make are just in the careless language that we use. So really important that if you're working with colleagues, that you have enough trust in your relationship with your colleagues for them to be able to point out to you, or for you to be able to point out to them, perhaps an instance where, without intention, you may have been perceived to have been judgmental. The fifth basic principle is to have an understanding that as a professional, an allied professional or a direct professional working with people in any setting, but particularly in the palliative care setting when people are so vulnerable, is that you have positional power. So people will be more influenced by what you say than if you did not have that positional power. The good thing about positional power is that you also have the potential to have a really positive influence. But always important to keep in mind how literally people might take what you say. And the more vulnerable they are, the more likely they are to do that. The sixth and the last basic principle is the language that you use. We will talk about a tool a little later, a communication tool, that will give you some tips on how you might slightly alter your own language to make it easier for the people that you're working with. But the risk that any profession faces when they're dealing with people generally, but particularly, again, those who are vulnerable, is the use of acronyms. So when you're with a professional group that understand everything that you're talking about, it's easy to take shortcuts and everyone's with you. When you come to work with people who are not part of that group, they will not necessarily understand the acronyms that you use, and frequently they're too intimidated to ask. So when you combine that use with positional power and with the potential judgment, there is an enormous potential to be far less helpful than I know everyone would like to be. With those principles in mind, let's talk to some of the more specific things about communication. And before we do that, I'm mindful sitting here that perhaps tuning into a communication podcast or video about communication may not have immediately prompted you to think about yourself. But I guess one of the underlying messages I'd like people to hear out of the time that I'm spending with you is that there's only one person's communication that you can change, and that's your own. So every time I say anything, I will be encouraging you to look at yourself, look at what you're confident that is working well for you, and to think about maybe looking to understand why people might react in a way that's unexpected. So let's move on first of all to what in my experience have I seen are the things that will influence the way people communicate. And I'm not going to go into these at depth, but I think it's good to keep them in your back of mind when you're trying to develop an understanding of how different people communicate. So there are 4 influencing factors, as I said. The first of those is the family history of the person who's communicating. We all have some sort of history that we've grown up with, and my belief is the older I've become, the more I believe it's probably the greatest influencing factor on how we communicate is our own family history. The second influencing factor is our self-esteem. I understand self-esteem as not how the world sees me, but how I see myself in the privacy of my own head. The third is the style in which I have learnt to communicate, and I'll talk some more about that in a moment. And the last thing is the generation. When you've been around as long as I have, you've learned that there are definite differences, and particularly in my working with multi-generational families, it's very clear that there are significant differences in the way different generations think, and therefore significant differences in the way they communicate. What I often notice is offensive to one generation is acceptable to another. And when you're dealing with families in a palliative care situation, you're going to be dealing with multiple generations. So it's really helpful if you can get a basic understanding of the needs and values of each of the generations. So, the greater our knowledge and insight, both into ourselves and others, is a large influencing factor in how skilled we become. Communication is a life skill, and the longer we've lived, hopefully, the better we get at it. I think the thing that I see underpins communication that goes wrong is often the inability of people to communicate about their feelings. The palliative care setting is an emotional one. However, the emotions that people feel can be very different within the same family. I've always followed the Steve Biddulph approach to understanding emotions, and he likes to think that there are 4 primary emotions: sad, angry, scared, and happy. What I have learned in my work, both in counselling and with families, is that it's unreliable to assume that because of what you are seeing with someone else, that you know how they're feeling. Certainly people of my generation, women in my generation, were given very clear messages that it was okay for women to be sad, but it was certainly not okay for them to be angry. And certainly men in my generation were given the message that it was okay to be angry, but not okay to be sad. So what I've observed, and especially with female clients, that they would be crying, and I would say something like, well, would you like to tell me what you're sad about? And they would almost hit the roof and say, I'm not sad, I'm angry. And so just because someone's tearful doesn't necessarily mean they're sad. And I've always found it helpful to say to people, so you want to tell me what's going on? And if they say I don't know, which frequently people do, I will say to them, tell me, is it closest to sad, angry, or scared? I don't usually have to ask them if they're happy. Not too many people fronting up to see me come because they've got too much happiness in their life and they don't know how to deal with it. Equally, I found dealing with particularly older men who appear to be aggressive, and when I interrupt their flow and ask them to tell me what's going on for them, I'm astounded at how frequently their eyes fill. And if I just let them sit, often those tears will start to run down their face, which is often an enormous shock to the rest of the family who've never seen that before. So really important that people are actually able to communicate which of those 4 primary emotions is being triggered by the situation that they're in. And it's important to understand because sadness and fear are de-energizing emotions. Anger and happiness are energizing emotions. And any one situation is likely to trigger fear or sadness in one person and anger in someone else. And so when you think about the energy that those people are expending, it's almost like they're working against each other. The fearful and sad people are wanting to withdraw, and the angry people are wanting to push forward. And so that can often end up with a real nexus in the family. And in some families, that dynamic may already be there before they come into the palliative care setting. The family that you're working with may be a family that have not been allowed to express some emotions. And so it's difficult for them then to manage in a situation where they believe that it's not okay to express some emotions and it is okay to express others. So again, for the clinician, really important for you to understand, are there any emotions that I'm reluctant to communicate about? Or alternately, are there any emotions that I'm really uncomfortable about when someone else expresses them? Because one thing that I've learned in my clinical work is that if I'm not okay with it, people will innately sense that, and so they won't share that with me. And my belief is that they will innately sense that in you as well, and they will not share that emotion with you either. So therefore, your ability to be helpful can sometimes be marginalised. So, scared, angry, sad. Probably don't have to worry too much about happy, but understanding where the energy is behind those different emotions. So if you are comfortable communicating with your emotions and sitting comfortably with others as they communicate yours, your ability to be helpful is going to be significantly enhanced. So that's feelings. Often when we're learning to do anything, we're told to fake it till you make it. One of the things I really hope that you'll hear from this time that we're sharing together is that you can't fake genuineness. So about being comfortable with the communication of feelings. Faking it won't help you make it. You really need to be comfortable within yourself with all those different emotions. So that's communicating about feeling. The next single biggest influencing factor, as I see it, in the way we communicate is our own behaviour. So our behaviour influences the way we communicate. So the more we know and understand about our own behaviour, the more able we will be to communicate effectively. I've always found that the really simple version of the DISC quiz, which you'll find in the resources component of this video, has been a really helpful tool for me and for others that I've worked with in understanding how they might alter their own communication ever so slightly in order to make it easier for the people that they were communicating with. So, again, we come back to having a better understanding of yourself. Our behaviour is an integral part of us, and again, the more we understand about it, the more able we are, A, to work with it, or B, to make change. So, when we look at the DISC quiz, basically it will say that naturally some people are talkers and some people are thinkers. So some people need to talk things through and some people need to think things through. So as a clinician, it's helpful to understand that the speed at which you deliver information is going to have a significant impact on those who are hearing it. So talkers tend, as a general rule, to think more quickly and less comprehensively. Thinkers tend to think more slowly, but much more comprehensively. So people will give you a hint when you meet with them whether they're going to be thinkers or talkers, and that will help you know how best you are to communicate with them. On the DISC quiz, the talkers and the thinkers are categorised as extroverted and introverted. However, extroversion and introversion has all sorts of other meanings for all sorts of people, but it's just really important to understand whether you, process information internally by thinking about it, or whether you process information by talking it through. So it'll come as no surprise to any of you, I'm sure, that I'm a talker and I process information by talking it through. The second component of the DISC is about your first reaction. So is my reaction a what reaction? What will be affected and what needs to be done? Or alternately, is my first reaction a who reaction? Who will be affected and who needs to be involved? So this area of the DISC is known, the divisions, like the others were extroversion and introversion. This is task and people. So someone who's an extroverted people person might look something like me. Someone who's an introverted task person might look like someone who works in the law, perhaps, or in accounting, or perhaps in palliative care. So it's really good to understand the different combinations. Some people might be thinkers and doers, or thinkers and people. So just understanding those 4 different categories that people fall into. First of all, knowing where you fit. And I can't encourage you enough, if you haven't done the simple disc before, to go to the resources that are in this video and get a bit of better understanding of yourself. Not only will it help you be clear about where you are, but it will show you some of the language tools, some of the simple words that you can change to communicate with someone who is different to you, particularly the people who are very different to you. So it doesn't necessarily mean not being genuine. It just means tweaking a few of both the way that you express things and the words that you use. So I'm reckoning that if you get a reasonable grasp on communicating about your feelings and a reasonable grasp on behavioural styles, both your own and the people that you're working with, you're going to be a lot further along in the journey to communicating more effectively. So, people who want an easy ride don't end up working in palliative care. Palliative care is a special and sensitive setting, and there are 2 wonderful gifts that I believe any clinician can give their clients in any setting, but particularly in palliative care. And they are the gifts of genuineness and time. Because there are 2 things that people need when they're under enormous pressure. They need to be around people who are real, who have enough self-esteem to have the confidence to be themselves, and they need your time. And particularly people who process information in detail need more time. So I wish you all the very best in your communication journey. Should you decide to make some changes, not only will your professional life be easier for you, your personal life will be too. So thanks for spending the time with me, and all the very best.